Hi, and welcome back to another episode of Your Health Transformed. Today, I'm really excited to talk about hormone and how hormones can dramatically change your life for the better. We have author of Hormone Secrets, Dr. Yoho, and I'm so excited that he is now on the show and he's going to be able to talk about everything in this topic, the good, the bad, and even the ugly. But it's great because he's going to enlighten you, he's going to enlighten me, and I'm really excited to talk to him and get his thoughts on this topic. So welcome to the show, Dr. Yoho.
Thank you so much, Franchelle, for allowing me to speak. And we're colleagues. We're on first name basis. You're welcome to call me Robert if you want. And I have a 10-second disclaimer that I've got to do because of all the plaintiffs' lawyers out there, and you know all about them too. We have to say that this is not specific advice for any individual patient. It's
Correct.
general advice. And if you need help, you got to find a licensed provider and get your advice from them. So, but I've spent years working on this material, and I think it's all true.
So I looked it up, and your background, I mean, you do several things. You're like rock climber, you're board certified in emergency medicine, you do cosmetic surgery. So what made you decide to become an expert and treat and do bioidentical hormone therapy? I'm curious what your story is.
Well, you know, I can go over my background ad nauseum, but and I was a Boy Scout, Eagle Scout once too. But it's all kind of irrelevant. But so I'm a retired guy now. I've been out of clinical practice for 2 years, and I'm just doing academic work and writing these books and so on. But what got me interested was I went to several hormone seminars I've got a general kind of curiosity about things. And in cosmetic surgery, we primarily deal with women. And
Yep.
the menopausal symptoms are very prominent in women over 45 or 50. And so I got interested in it. I gradually learned more and more, and I trained, and I finally was certified in bioidentical hormone administration. And then I wrote this book. Now, I was never a full-time hormone doctor, so my
Mhm.
experience is more limited, and it's primarily women, although I have treated men. But I did write this book and survey all the literature about it.
Yeah. Perfect. Perfect. And for the audience, do you mind going over some of those postmenopausal symptoms that you saw, for example, in your own
God.
practice? And then I'll add my 2 cents.
Yeah, we both have enormous intimate familiarity with that if we've had a female practice. And of course, being 68 and retiring at 65, all my patients they were following me up there in the age groups. And
Yeah.
so for the last 15 or 20 years, I had a lot of patients over 45 or 50. So, everybody knows about the hot flashes and the
Mhm.
fatigue and the anxiety and the depression, but not everybody understands that intellectual decline and muscle weakening and many diseases are associated with menopause. And a lot of these things are avidly treated or even prevented by hormone therapy, particularly estrogen.
Yeah, wow. And we'll get definitely more into that. Like one of the things that got me into hormone replacement therapy is one, as you know, I kind of reviewed the literature and saw all the benefits. And my patient population was predominant obesity, interested in some type of weight loss. And I noticed that when I replaced their hormones, they lost weight. Sometimes that was like an independent reason, just hormone replacement for their weight loss. So once I saw that, and not only helped with their sleep, which can cause weight gain, all these other effects that cause weight gain from abnormal hormones, that's why I introduced it in my practice. And I saw dramatic results. So I'm curious to have this conversation about what you see, because one of the biggest things that I got, and I'm interested to hear your opinion when patients came, believe it or not, it was a lot of pushback for bioidentical hormone therapy. I would have patients who would come in and you check their labs and they're completely off. And I'm like, I know hormones would help this patient, but then they would be like, oh, my family practice doctor said, no, I don't there's a study, I shouldn't get hormones. Even OBs were really against hormone replacement therapy. And I really had to almost like educate my patients on the literature and how this worked out. and almost convince them. But I didn't, I'm like, it's up to you, but these are the benefits of it. And this is what's true. And this is what not true. So I'm curious to see what you saw in your practice when you were doing
Well,
this.
yeah, testosterone is well known in our community. I mean, I'm talking about the hormone replacement community to be the best weight loss drug that was ever invented. It's better than phentermine. It's better than fen-phen. It we have observational studies that go out 10 years, and they these of men who plane the weight off gradually over a decade.
Yeah.
It perks you up. It gives you the energy to exercise, and it gives your muscles the ability to consume fuel. And I mean, there are many, many, many benefits. And since testosterone gets broken down to estrogen, I think a lot of the benefits are estrogen administration. So, and of course, in males, we always check the estradiol levels because we wanted to be sure that they were getting adequate amount of testosterone, which converts to estrogen. It's just as important in men as women.
That's an interesting fact. I want you to kind of expand on that because a lot of my patients, when I'd be like, you need testosterone, my women, they're like, what? Testosterone? I don't need testosterone. And I don't give high doses that I would give in my males. And then the fact that you're saying males also could use estrogen, this is almost like a common myth among patients. Like men don't need estrogen and women don't need testosterone because men are like, I don't want the gynecomastia, which is breast in men. So I'd love for you to kind of expand on, those myths, so to speak.
Yeah, the testosterone is acknowledged to be an excellent monotherapy for hormone replacement. And what I did, and you're probably well aware of this, dealing with sick patients and hospitalized patients, a third of the drugs you give patients as outpatients are thrown in the trash and never used, right? So I had to
Mm-hmm.
figure out a way to explain to my patient that these things worked without spending a lot of time like begging them to use the medication and so on. So, we're see the audience is laughing and we're laughing too because we're clinicians and we understand how difficult it is to convince anyone of anything.
Yeah.
Look, Franchelle, I've got to do this, especially women. Did I
Yeah.
say that? Okay, so arguing with women is like arguing with Germans. You might as well forget it. If they're
That's
not interested in
okay.
the hormone therapy, I did not ever go there. It's like, are you interested? No. Okay, we'll just do your boobs. But like, unlike most plastic surgeons who operate on a string of depressed and anxious people trying to treat their menopause with surgery, I felt ethically obliged to learn about this stuff, and
Yeah.
I step by step got better and better at it, and I eventually offered every surgical patient a free testosterone pellet, which, as I said, gets broken down to estrogen, and it supplies the entire thing. And I always stuck it in through the umbilicus, so they can't complain about the scar.
Yeah.
Otherwise they're like looking over their shoulder in the mirror trying to figure out if they have a scar on their backside. For
Yeah.
the little trocar, it's like maybe a 4 gauge trocar, so it's a pretty big needle that you push the pellet in with. And
Mhm.
so I would offer them. I would do the informed consent if they were psyched about it. Never if they weren't psyched about it. I would do it for free, and it cost me $15, $18 for the pellet. And
Yeah.
I got the satisfaction from these women that was just out of this world. I mean, they come back in 2 weeks and they just be chirping.
Yeah.
They'd feel great. Their energy was up. Their sexuality would have returned in that short a time interval
Yep.
as the pellets, and it freaking lasted 2.5 months to 3 months. And that way I could convince them that it worked without having compliance issues. So
Yeah.
I mean, it was great. I just offered and did it and signed the consent, and I got to do things that I thought were much more important than the cosmetic surgery. I mean, the lipo, they gain the weight back, they gain the weight on their
Right.
arms. I mean, you've seen it all before too.
Yep. Yep.
But with the bioidentical hormone therapy, I could make a permanent improvement in their health. And I still have patients who are still on the hormones, and they call me occasionally. Of course, I'm retired, so I don't do anything but refer them. But
Yeah.
it's been a very satisfying part of my practice.
Yeah, no, I think that's great. And earlier we were talking about the benefits of estradiol. And so I'd like for you to kind of expand here on what you
Yeah.
were saying, pellet versus oral, kind of your take on that.
Okay. So this is an important point, and it's well established that oral estradiol, but not pellet or cream or patch estradiol, reverses and improves the heart. right? It
Mhm.
reverses coronary disease, and there's pretty good evidence of that. And
Huge.
the others, the patch doesn't. Now the patch, of course, relieves symptoms, and there's a confusion about some of the studies because there are some problems for older women, right? And
Yeah.
there's slightly elevated incidence of heart attacks if you start estradiol in older women, but not the patch, right? It's not oral. So
Yeah.
there's this confusion, but the net of the risk profile is that the oral is much better, and it has much more avid effects. And if you're trying to actually treat the patient and not just treat the symptoms, you need to use oral estradiol, and you got to get their levels up to 80 to 100. And same thing with progesterone. The topical progesterone, the pellet progesterone just doesn't freaking work. And you can prove that to yourself by checking the levels. The levels are never high enough. The levels should be 10 to 20. I think these are picogram per milliliter, but I always get it
Yeah, they're
confused in
always
which
less
direction.
than, I've noticed. Progesterone is always low in my patients, almost like a vitamin D. It seems
It
like every patient's low.
Well, you're dealing with premenopausal women too, right? And
Both,
so,
both.
yeah, both. So, progesterone is virtually harmless. It can be replaced in premenopausal women. A lot of women have PMS symptoms the last 3 days to 2 weeks of their cycles. You can do that in a 22-year-old, and they get tremendous benefits from it. You see a lot of PCOS, I'm sure, in your obese
Yep.
patient, and learning about thyroid replacement with bioidentical thyroid with T3, T3, T4 porcine combinations, and pushing the progesterone will often allow those women to get pregnant. I mean, it's a huge, huge thing. And
Wow.
you rarely have to do very much else in younger women with PCOS.
Yeah,
And
that's great.
I don't have a lot of experience with that, but I read all about it and I wrote about it in my book.
Yeah, no, I think that's great. I would
It's got to
like
be
to get
oral
your
progesterone.
thoughts
The
on,
topical progesterone just doesn't work. We've checked levels, and you'd have to put it on 5, 6 times a day. You see, because it just
yeah,
doesn't stick around. Topical testosterone, on the other hand, does work for women, and you can use it. And they may only need it 3 times a week because testosterone sticks around in the female body, and it's like a freaking miracle. I mean, it really helps their sexuality and their muscle tone and their attitude and everything else. Hot
yeah.
flashes, yeah.
Yeah, yeah, I think that's great. What do you tell either other providers or patients who have seen or want to know about the Women's Health Initiative study? Because
Oh
that's a
my
big
God,
study that came out years ago now,
yeah,
but
early
everybody's kind of
2000s.
still refers to that. I don't even know if there's been anything that's kind of, there's been some, but tell me your thoughts on that study.
Okay, so that was probably the most expensive study ever performed. It cost about $1 billion, and the it's been examined by various authors, and I reference that in Hormone Secrets, which I'm going to send you a copy, and you can look at that. And you'll have my
Perfect.
the ebook's only $4 on Amazon. I don't make any money
Wow.
off all these efforts, So it's just and the ebook you can click through to all the references very conveniently. But that study basically has been debunked, and it was
Mhm.
actually obsolete the day they published it because they examined horse urine estrogen, right, Premarin, and they
Yep.
examined Provera, which is not bioidentical. It's a
Correct.
synthetic version of progesterone, which actually is the bad actor in
Yep.
the hormones. Now, I don't want to exaggerate the harms that were found in the Women's Health Initiative. It basically we're much better off with synthetic and horse urine estrogens than no and progesterone than nothing at all. I think the people still live longer and do better, but it's not anything as good as the bioidentical hormones, which you can get from the compounding pharmacies,
Correct.
and they're cheap. They can't be patented, and so they've been run down by big pharma. And what the FDA, which colludes with big pharma, put black box warnings on testosterone, estrogen, and progesterone. I mean, it's absolutely insane.
Was that for bioidentical too, or just
Yeah. Well,
all?
the
Yeah.
thing, yeah, that what they did is they did stick it on every form of. And now there are bioidentical progesterones, for example, prometrium that you can get,
Yeah.
as a prescription. And that same warning is on prometrium, and it was
Okay.
based on Women's Health Initiative study of Provera. So
Right.
it
Which is two
basically
different things,
two
not even the
completely
same
different
thing.
things. Yeah, and so uh, your prescriptions don't involve the cancer risks or the other risks that the old hormones would. And the worst thing about this whole thing is these horse urine estrogen and the synthetic progesterones are being advertised on TV still.
I was
I
going to
mean,
say,
it's sick. You
more
know?
of my patients are on Premarin than any other, you
Yeah.
know what I'm saying? And I'm like, get off of that. Like, that's what, but
Well,
it's
it's much better
amazing.
than nothing. It's much better than nothing. And if they like it, why it doesn't, it's not tremendously hazardous. The hazards found in the Women's Health Initiative study were primarily Provera, and they're measured in a few per 10,000. There are statistics that are too small to have any clinical meaning, but they don't make you feel as good as estradiol in oral form, which is
Yeah.
the way everyone should take it, in my opinion, or the progesterone in oral form,
Yeah. Yeah. I
which
agree.
gets you good levels.
Yeah, no, thanks for clearing that up because, I still get people, providers and even patients like referring like, "Oh no, I shouldn't." One of the first things that some of my patients tell me sometime when I'm like, "Ooh, you're home," cuz on my panel it routinely comes with hormones. So everything that can affect weight
Good for
or
you.
cause weight gain, I
Yeah,
check
yeah.
in almost like my initial panel. And so that includes hormones because that's a huge effect on weight, irrespective of surgery. And I tell my patients this, even if you get bariatric surgery, you are still going to have this problem if it's not replaced. And I at least give them the education and then let them decide. But one of the biggest things that they'll say is, "Oh, that's going to cause me cancer." And I'm like, "Oh, okay, let's have a conversation." So have you heard that, and how do you respond to that?
Well, I wasn't forced to treat the problem, right? They were there for their boobs or something. So I generally didn't argue with anybody. If they
Yeah,
weren't interested and they started that line, I knew that they'd be back and forth comparing me with their local gynecologist or some other
correct.
general practitioner who would tell them about the cancer and all that. And so I eventually wrote this book, but that was after I retired.
Yeah, so
So
it wasn't worth it for you to deal with. You're just like, okay, that's fine,
yeah,
refer them back and then put all the information that they need to know in this book.
if they start to argue with you, you say, "I think you really need to see the other doctor because I'm not sure. I'm not sure we're the best fit." But I think what I did with the hormones was far more important than any of the cosmetic surgeries. I mean,
Yeah, I
I
agree.
yeah.
Same with my bariatric surgery. Like if you don't have some of these other things fixed, whether it was vitamin D, thyroid, hormones, I mean, you're only going to get so far with your bariatric surgery because there's some underlying things that just are not we didn't, replace. We didn't bring to normal levels. So I
The
I, I 100% agree with
the
that.
rule of thumb with hormone therapy is that almost all the problems are due to not giving enough hormone, right? There's
Hmm.
almost no problem created by too much hormone, with a few rare exceptions. But I mean, the commonly, I mean, even the people who talk about it and write about it say we just give enough to get rid of the symptoms. Well, you can treat the symptoms if you want with the lowest levels that you can possibly give them using
Yeah,
a patch for estrogen, for example.
correct.
But to produce the health benefits, you need to have your doc check the levels, and the levels have got to be up to a certain amount. And things like cream or pellet progesterone never produces high enough levels. I mean, I just I repeatedly saw problems with that, and the cream you'd have to do it multiple times a day. So
Yeah. Yeah, which for some patients was a pain. They'd forget and then it wouldn't be as beneficial.
you
The other
can't
thing
do
I
it.
noticed or had a lot of, because I checked levels routinely, like every 3 months, like whenever they were kind of due, we would check to see where they're at and then I would readjust. But I noticed a lot of people who may have come from other places, they would just get the same dosage. And then they'd come in if they were a new patient to me, "I want this dosage." And I'm like, how are people dosing this without getting appropriate blood levels? Like, I never, so for all the patients out there, I personally think that blood levels need to be checked. Don't just, otherwise you're just shooting in the dark with a dart, like what you should be getting.
It's
Go ahead.
It's true. It is. I just want to bring up the other point that American College of Gynecologists, ACOG, they believe that you can treat postmenopausal women without getting levels. So the physicians listening to this should not be afraid of that, because there's a standard that you can do that, and generally the doses are relatively standard at the beginning.
Hmm.
But then they have to be individualized, and it's very helpful to check levels once you get them going on the right trained, so to speak, you can check the levels
Correct.
once a year, and
Correct.
just pat them on the back once a year. A lot of these clinics, they just see them virtually once a year, and I think that fulfills their requirement for a good faith exam.
Yeah.
Um,
I agree. And I would also agree, and you can agree or disagree, that there's a difference between treating the symptoms of menopause and then actually treating medical conditions that can also be treated with hormones. For example, like you said, treating a heart condition, treating preventing perhaps cancer, or treating diabetes, et cetera, et cetera. What are your thoughts on that?
well, you got to get the levels up, otherwise it
Yeah.
doesn't. Now, somebody with severe heart disease, the practitioner in America who's confronted with all the liability concerns might want to stay away from hormone prescribing for somebody with heart
Yeah.
disease, even though the risk benefit ratio strongly favors taking oral estrogen at a minimum. Of course, you cannot take estrogen without progesterone if you have a uterus, because that brings the chances of uterine cancer up. And that's that's sort of one of the basic ground rules and one of the
Right.
pitfalls that some of the people who don't have any background at all in this field, they make that mistake. Uh,
Yep.
but it. So
Yeah.
go ahead.
So, what other nuggets would you say is in this book for the audience? Like, what other things would be helpful? What else do you discuss? Is it just hormones? Do you discuss? I saw other topics on there like thyroid, vitamin D. So, just give us kind of an overview.
Okay, so we have more experience with hormones than any other drugs long term. In other words, thyroid we use since the 1800s, over
Oh,
120
wow.
years of experience. Progesterone, estrogen, testosterone, 50, 60, 70 years of experience. I mean, it's incredible. There's slightly different forms that were used, but we just
Yeah.
have this, and we have thousands of observational studies. The randomized control studies that are so expensive never get done because these things are not patented. So I want to emphasize to your audience that we have a massive experience with this, and if you can find someone who is knowledgeable about it, and I like our particular group, worldlinkmedical.com. It's a relatively small group, and it was headed and founded by someone who was an innovator named Neil Rosier. He's a physician. There's another group called the A4M, which is American Academy of Anti-Aging Medicine, and
Yeah.
they are a little flakier. They have people in the lobby with magic crystals. They're selling, they're selling foot
Yep.
massagers and all that stuff. But it's still, most of it's valuable. They get most things right. Um, so you can go to these groups and you can get a referral to a local physician.
Perfect. Well, thank you so much for being on the show and kind of enlightening us on hormones and hormone secrets. I recommend everybody to go, if you're interested in this topic, to grab his book and educate yourself on hormones, especially if you're on the fence or unsure and you want to get somebody who's very knowledgeable and would be able to take care of you. So thank you very, very much, Dr. Rohu, Robert, for being on the show.
It's my website is robertyohoauthor.com, and I have a Substack called robertyoho.substack.com. So thanks.
Perfect.